Okay. Well, welcome back, everybody. I hope everybody is back. I hope you haven't lost anyone. And thank you very much for taking part in that. And we had a bit of a problem with one of the breakouts. That's why you were given a bit extra time. So even though we're running just slightly over time, it doesn't really matter. So what I'd like to do is to invite the chairs of the breakout rooms to present their feedback. So I'm just going to do them in order. So breakout room 1, who was that?
That was Bev.
That was Bev, okay.
If you unmute yourself, Bev.
There we go. Right, thank you. It was a really good discussion, and I was just trying to write a note there to my room that essentially someone was in mid-flow to make a point and got cut off. Bless, it was David Pether. So I said to everyone that if they could just questions, if they weren't covered in the chat. I think there were some really good questions, basically about. Obviously it's there was a discussion, excuse me if I don't have everyone's names, but David Humphreys made the point that we need to identify, perhaps even break our regions within the NPC and try and match them up to the ICSBs, to the boards, and perhaps then also identify other groups within that area. I think the point that was made by Tony was that, we do need to have further meetings, and possibly even at national and local level, where we can pull together concerned groups, both, a national and a local level, to work towards this. So I think that was a good point that that David actually made. Let's have a look. There was Damon made a point about just the issue in London. That there are a lot of privatised, GP practices in London, and there's a lot of concern about that. But I think he was finding out, and he's going to post that again. There's something like 4 or 5 boards within the Greater London area. So it's quite important for people to just understand and know who those who their boards are. And it's online, but we should maybe try and help people to find that. Right, I think there was Claude, I think, made a point that it's obviously it's a big movement here to push the NHS and privatisation, and that really it's really up to local communities and to the trade unions and everyone, if it's political parties, to who care about this, to get together and at national and local level really press the case and flag up all the issues which we heard about from people today. He did cast some doubt on the ability of the Labour Party, their commitment to basically carrying on the campaign now the act is in law, but I think they're fighting quite in a lot of corners, so it will be interesting to find out a bit more about what we can do. There was a big, Claire spoke at length about big problems with local access, and she had a number of points to make, and I'll basically online, but there's obviously big problems with access to GPs. She, has certainly gave examples of, the GPs, number of full-time GPs is very low, and they don't actually, they don't have to seem possible to get an appointment. She mentioned that it depends, again, this kind of postcode lottery. In an area she was with a teaching hospital, teaching A&E, then the service you can get is very good. If you live somewhere else and you don't have that on your doorstep, it can be, quite patchy and variable. You really would expect that wouldn't be the case within the NHS. And so I'm just flicking through this. I'm nearly there, honestly. And there was just a point fighting for universal health care. There's obviously almost like that about the propaganda suggesting that the NHS is struggling, when in actual fact, it's really down to, we need to, the message that we get out to people that the services are there, they're just not being supported, given the help that they actually need. And there's a good point towards the end that we need to look at how, a lot of us can remember when the NHS always had problems, but it worked better than it is right now. And the point being that we should, young people today, all they can see is problems with the NHS. They don't know what it was like when it should be working properly. And so therefore we need to engage about the value of the NHS and how different things are, even going before the NHS was set up in the 40s, how different things are, but we'll only miss it when it goes. So we need to get that campaign going that, to be honest, help people to understand this is NHS care under attack, and you will miss it when it's going, and it's going fast. But that's it. Sorry, it's a bit rambling.
Thank you, Bev. Who was in room number 2? Sandra?
Yes, okay, thanks. Yeah, we would have liked more time, and unfortunately we did have a technical problem in our group, but we're really sorry we couldn't do anything about it today, but lesson learned for future events. We had some interesting points that were made, and one of them was about that although this is a health and care bill, there is little to say about care in the bill. And one of the points that was made was that this isn't just about the discharge of people with care needs. It's the fact that people with the most complex medical conditions and high-level needs are likely to be in care homes, and their access, particularly during the pandemic, to the specialist services that they need has been limited or almost zero, recognising that GPs are not specialists, but people in care homes are not getting access to the the particular specialisms that they require. One of the points in terms of getting the message out, and we know that this isn't possible for everybody, but where possible we should use social media, because it is a way to get messages out quickly and widely. And, I know that, for example, those who do use social media will see how fast people share messages that we put up. Meg told us about the work that she was involved in with Save Our Hospitals campaigns, and emphasising the importance for getting stuck in at a grassroots level, and that we need to get the local community organisations, make them aware of what's going on and get them on board. And a very important point, that let's get those letters going. Let's get letters sent out to MPs, to the care boards, to whoever we can, to highlight our concerns. Pat raised a very interesting point, which is that apparently, and this is in terms of regulation, is that anybody can call themselves a nurse. Now, I hadn't realised that. You can't call yourself a registered nurse, but anybody can call themselves a nurse. And the Royal College of Nursing is currently having a campaign to actually protect the status and professional expertise of the word nurse. And I think that, yes, Janet raised a point about can we keep feeding information out so that people know what they should be looking out for, so that if they're dealing with and engaged with services, what sorts of questions should they be thinking of? How do we actually help to monitor what is happening? And I think I think those were the key points there. But yes, we could have gone on for another hour and not exhausted the topics. Thank you.
Yes. I think we could go on for days, Sandra, but thank you very much for your feedback. Room 3, who was that?
That's me, Jan.
It's you, Miriam,
And
yeah?
apologies to my group because they were in the room and I kept ending up in the wrong room. Don't know how it happened. So it was a very rushed through session.
Okay.
And I would encourage my group that if you didn't have a chance to say what you wanted to, make sure Jan hears about it. What we did hear was the problems that were causing concern were the discharge problems that have been mentioned, the difficulty of getting appointments with doctors, the delay in operations, the lack of integration between services, and the lack of patient involvement at board level. On what action can be taken. Well, people are very keen to write letters, for example, to hospitals against departments being closed, protesting outside of surgeries about the possible Americanization of our health service, contacting local councillors because they have got other avenues that they can explore, joining the Own It, that was said very forcibly, and using PPG groups, that's patient participation groups. Each service should have one, and they presumably have contacts with their practice managers. I mean, I chair one. I just put out a newsletter yesterday about this, put stuff on the website and so on. But I have to stress, Jan, it was very rushed, and I know we didn't manage to get everybody in that wanted to.
No, and we apologise for that. It's the first time we've done this, and
I know.
Despite our run-throughs, like I say, the Gremlins are there to have a party. I would encourage anyone who wants to, if it's too big to put in the chat, or you've got to leave and you haven't got time to do it, please email in the issues. That goes for every group, every breakout room, but particularly breakout 3, since you had the misfortune with technology. So anyone, just please write in with an email or send me a letter or phone me up, whatever you want to do. It's really, really important, this. So Christine, you are the last room. Thank you very much.
Yeah, my connection failed just as we were due to go into the breakout room, but I managed to get back in, so we may have been a bit late starting. Yeah. So I apologise to my group for that and encourage you to use chat or to email Jan. 2 people raised the issue of new hospitals being built in their areas and the opportunities for privatisation that that's likely to give, and also that bed numbers are being reduced, or bed numbers are already too low, and a concern that they're moving, with one of the hospitals, they're moving to more day patients, but a concern there that there won't even be sufficient numbers of beds for the day patients. The other issue that was a concern to several group members was the discharge to assess policy, where people in hospital are discharged for an assessment of their social care needs to take place afterwards. And there was a question about whether it will then be possible for those people to be readmitted to hospital if they need it, or if they're just going to be left without any care, because as we all know, social care is in crisis and there can be months of waits for an assessment and for services to be put in place. And I've seen nothing in the legislation that makes clear what would happen once people are discharged if they're not then getting services and need to be readmitted to hospital.
Yeah.
On the question of what to do, one person talked about greater contact with the local Unite union. Well, a couple of people talked about that. Others talked about we own it.
Mhm.
And the letter format, the letter template is very useful. There's an information bus on the changes go to one area. So Ian Morgan said he'll be going there, and trades also contacting trade councils about these issues.
Mhm.
And Tony O'Sullivan said there's really a heightened need to have a voice, to write or email local ICSBs and to put up a political fight, so to contact local councillors
Mhm.
or presumably also MPs. And I think that was it. I mean, just a concern about the increased level of dangers and risks to people, the variety of risks to people.
Yeah, I think that was my one fear when I read that part of the bill, that government seems to be abdicating its responsibility for health and safety of the nation, really. Thank you,
And there
Chris.
was one other concern from the Hornsey Pensioners Action Group, that they only have 4 people who are IT literate who can use Zoom. So there's a large number of retired people without IT skills who aren't going to be able to use the IT methods for contacting people and raising issues.
Yeah.
So it would just be through meeting or writing, so the old-fashioned methods.
Yeah, I think what we need to do now, if I can just close this part of the session and say thank you to all the chairs and everybody that participated despite our gremlins. Right, I'm gonna bring back Simon and Tony and just ask them, do you have any final statements that you want to make, that perhaps now you've listened to what the feedback is, that you feel we can engage with? I mean, we need to go through this. We need to set up meetings. I think we are part of We Own It as well. We've got quite a lot of partners that we share our work with. And I think it might be very good to bring everybody who's got an interest together in that campaign arena to look at how we go. In the meantime, we can all take, the local action that's been talked about. So do you want to add anything or pick any particular point up, Tony?
Thank you very much. And thanks for the whole session. It's been good. Very good. Just first point that was made about IT access. It's also, of course, a point about the assumption from the government that we can move into a digital area where patients access care. So not only is it hard for you to campaign if you don't know how to use Zoom, etc., but it's also hard for you to contact your GP or get access to care if you don't have good IT access or indeed communication skills. So I think that's really important. The other point that was interesting, that there's a lot of young people that don't have any memory of when the NHS used to work. And I found that that's also true when I'm talking to journalists and being interviewed. They start off by saying, the NHS has always been in trouble, hasn't it? And you're pouring good money after bad, and it's all. And it was, in 2010, and actually for a short time beyond until austerity really hit, the NHS was very, very definitely the most democratic, the most accessible, and the most comprehensive health service in the world. We know it wasn't perfect, but it had with good support from the Labour government for over several years, it had started to get the funding where it was beginning to get rid of waiting lists and improve cancer care. It had not addressed social care, we know that, and it had not addressed the rights of the care of independent living for disabled people, etc. But it was on the right trajectory. And the person that said we need to somehow or other instill in people an image of what life was like without the NHS and what life was like when it was working really well. And for me, that's important. That's a kind of communication thing, isn't it?
Mm-hmm.
The overriding thing I feel is that, you know, having a union like Unite behind us is so important. And there are other unions I know, but, you know, I know Unite was solid on the Health and Care Act. Unison faced both ways a little bit, and they were saying there are good things and bad things, and you know, I would take issue with that. But so just in this discussion, we've got, you know, National Pensions Convention, Unite, We Own It, Keep Our NHS Public. I would value almost a preliminary discussion about how we can get our resources together and combine our efforts, because there's no doubt that what everybody's expressing is real anxiety. The NHS has never been in such danger, and yet it's such a wonderful institution. And if we could combine a nationally funded social care and independent living service as well, then the tragedy that we know is that, you know, private care costs more money and is in the interest of profit, not patients. So we should be arguing for something that's not only better, but morally, but also is more cost effective. So those are the kind of thoughts I had, that there's something positive in all this, but we need to get on with it. Unite itself as a union gives Keep Our NHS Public the most support of any union, and we are immensely grateful for that from money. But, you know, you need money to have full-time people working on this, and we need a team of people working on this to knit all our resources together.
Mm-hmm. Thank you, Tony. Simon, would you like to add anything?
Thank you, Jan. I think it's been very interesting, and so I'd really like to thank you for having me here. And I know I kind of came in place of Sharon, but it's been fascinating for me. I also was interested in, and you know, and immediately responded to this point about needing to make sure that people understand what an amazing asset the NHS is, and that and having that positivity around it, not only in contrast with what it used to be, how we used to be doing it sort of 15 years ago, or indeed the horrors of healthcare prior to the NHS coming into existence. But the other great contrast is with the private healthcare model in the United States, which is, as soon as you look into it, is so clearly failed. I mean, it's horrific. It doesn't work for anybody. It overcharges the rich and over medicalizes them, and then it doesn't give absolutely essential care to the poor and lets them die. I mean, it's a horrific model. And the idea that I was very concerned when Simon Stevens became head of NHS England, because he came very much from that model and he was trying to implement. And there's a long-standing issue there, and I know it's probably a little bit too late for the 75th anniversary to do anything extra of the NHS, but sorry, 74th. But we've got the 75th in 2023, which is quite a big thing, and it may be that we should be thinking about how to get that positive messaging on, out there as well. And I'm not suggesting we wait until then, but it's one of the opportunities perhaps to remind people of the value of what we've got and the importance of saving it. Obviously I'll report back to not only to Sharon but also to our national officers for health on the outcomes of this meeting and feed that in. And I do think that there's very much a will in Unite from Sharon, also from our chair, Tony Woodhouse, who is a passionate supporter of the NHS as well, to be more active on this. And I know that she'll be talking to you, Jan, about how we can team up, and very much also working together with groups like Keep Our NHS Public, who we absolutely do support, in order to make sure that we have a kind of block of support for the NHS. And I think that's certainly something that we will continue to prioritise going forward, and look at what other opportunities we have to do that.
Yeah, lovely. Thank you, Simon. Right, okay, as bits of information that where people have been kind of talking about things that the NPC's already done. I don't know how many of you might remember last year, the NPC became a member of the Foxglove legal case against NHS Digital, where everything around the data collection grab, as we called it, was online and had not been publicly consulted upon. We did a huge campaign to get the public, our members and the public, advised of what was going on, and also provided them with printed copies of an opt-out form if they wished to use it to opt out of that collection. Through Foxglove and the legal challenge, NHS Digital was paused last September, and there were 4 criteria. We'd not heard anything about it, but we knew from experience that something would be going on behind the closed door, so to speak. And true to form, in April, the government sent out an email to certain organisations saying, would you like to participate in our federated data platform? Now, federated data platform takes NHS Digital, the collection they were going to make, far beyond that. Now, not only had they not publicly consulted about it, again, it's still not clear who and how access to people's data will be made. So, once again, Foxglove and NPC is part of a consortium of interested parties, taking the Foxglove case, actually wrote to the Department for Health and Social Care and to NHS England and challenged their right to do what they're doing. We still have to hear from their lawyer what they think of our challenge, but it is, again, the same old, yeah. In terms of IT access, we have recently written to the DCMS, Digital Culture, Media and Sport. We've also written to Ofcom, the same letter, and the local government association, the same letter, complaining about public services going online and excluding not just older people, but anyone who doesn't have the means, the devices, the money to actually pay for broadband and be online. And it's a absolutely, in health, it creates a vacuum. And we've got real concerns about people's health, unable to get a GP appointment or get a specialist appointment, or giving up trying to get one, and their health worsening, not being able to get medication, and the opportunity for them to potentially lose their life through that. So we've been doing a lot of work on that. I think in terms of where we go from here, it is about the Unite, KOMP, NPC, and We Own It to come together, I think, in one meeting and look at what we've identified today, what you've identified, and set the priorities for how we set about this work. But it's really, really important that from today, those that have been here actually share what they've heard and their concerns quite widely. I mean, we need, we can go out to our regions, we can identify certain community groups, but there'll be other community groups that are not access to NPC or Unite or anyone else, and we need to try and get those into the fold, so to speak. So I think today what we've heard are some really, really excellent points and really vital information that we need to work on, and we need to look at how we, as I say again, work with the partners that we have. But it's a responsibility on all of us to remain vigilant and to stand up to the changes that we think are wrong, and to save and preserve local health and care services. We do have a template letter that we can send out. If you're not online, give us a call and we can print one out and send it to you in the post. There is, as Jonathan said, a recording of this that will be on the website. So if you missed any part of it, or you want to share that with your organisation or someone else, and you can use that. We're quite happy for you to use that. I've just got a message in here. Let me see. Judy Downey, it would be really helpful to put an opt-out form of words on the screen again. Just become even more urgent in the current political climate. Thank you, Judy. Yeah. I don't know if Jonathan can quickly find the opt-out form that we sent. If you can put it on the screen, that would be good. If not, we'll put another. It is already on our website, but we will attach it to the portion of the website that this is on. But we can also send them out again to people, and we can post them out again to people. So it's about getting in touch with us. Yeah. So there will be a report about this. It will take a little bit of time to put together because we're absolutely critically busy at the moment. But I do want to thank everybody. I want to thank our panelists, Simon and Tony. I want to thank our chairs in the breakout room, Christine, Marion, Sandra and Bev, and Jonathan for all of his hard work. And again, Bev, she's a member of staff, and without Jonathan and Bev, none of this would actually happen. And I know we've had our problems today. It's not unusual, but, we do the very best that we can. So I want to thank everybody and make sure that we continue this beyond today. And I hopefully will see some of you on Saturday at the TUC rally. So thank you very much, everybody. And I will now close the webinar and make sure that it probably won't reach the website this afternoon. It depends what Jonathan's got to do, but it certainly will be there tomorrow. So if you want to share it, please share everything that's gone on today widely and start informing your neighbours, your friends, your family, your local group, whatever. And we'll come back to you with a strategy once we've met with We Own It, Unite and Keep Our NHS Public. And we need to get that meeting done really soon, as quickly as we can. As Tony said, time is moving on. Okay, so once again, thank you so much. It's been, I think, a very informative piece of work. And again, as we do these webinars, they always make more work for us, but we're happy to do it. So thank you so much, and goodbye for now. And